One of the last doctors I saw when I was giving you guys an update in the last video, I drove very, very far. I had my hopes up. I was so excited to see this person. She acted like she was understanding that at this point in time, I would not like to get a mammogram. And like I said, I'm not against it forever, but I've had one semi-recently and I don't need to have those done repeatedly when I've repeatedly been told that they can't see through them and that I need to get an ultrasound. The VA used to always refer me to get breast ultrasounds. The reason for that is because I have what's considered extremely dense breast tissue, and as a result, in my past experiences, most of the radiologists will look at the mammogram and tell me, I need an ultrasound. They can't see through this. I need an ultrasound. So for women who have dense breast tissue, extremely dense breast tissue, ultrasounds can be very valuable and very helpful. But even with saying that, the doctors out there nowadays, they are trained. It is ingrained in them. No matter what happens, even if your breast tissue is not visible at all on a mammogram, they're going to tell you to get a mammogram, and that sure, you can get an ultrasound as a supplementary test to the mammogram, but the mammogram must be done. For me personally, I'd prefer to do the opposite. So I'd prefer to do the ultrasound, and if there are any issues with the visibility on the ultrasound, then let's talk about what you prefer and recommend next. And that is absolutely not the way it works with these doctors and radiologists. They won't tell you that if you do have dense breast tissue or extremely dense breast tissue, it is going to absorb more radiation when you're getting that mammogram done. For me personally, I've had a lot of radiation exposure because I didn't know any better, honestly, and I wasn't very well informed. And I had certain health issues at the time. My health is a million times better now, but I had health issues and I was getting care through the VA, and no matter what my problem was, if it related to any body part, joint, or whatever, they'd have me do a CT scan. And unfortunately, I have had so many CT scans, I can tell you it's above 23. There's nothing I can do about it. I'm not going to sit around and dwell on it. If I'm being completely blunt, that is the reason why at this point in time, if I do need to get a scan that involves radiation, I will get it done if it is absolutely necessary. If there is a better or safer or more logical method to be used, such as the ultrasound for my breast cancer screening, then I need to push through and stand my ground to get that done. I should have some autonomy when I'm trying to get medical care. So this doctor seemed to understand. She seemed very caring and nice actually at the time. And so I was very hopeful, which I don't recommend getting your hopes up when you're going for medical care. Just stay even keel. Just go with the flow and see how things go. But I ended up getting my hopes up, and I was so relieved because I thought she understood. And then she recommended that I get scanned. This was excessive, by the way, every 6 months with either an MRI with contrast, which is super safe in her words, and then alternatively, I can get something else that I'm comfortable with, which could be she didn't say ultrasound actually, I just remembered. She was against ultrasounds for her own reasons. She said she didn't have a radiology person who could handle that or who was skilled enough. So I was just happy that she said I could do something else. I know MRIs are highly effective, but at that point in time, I did not do a lot of research into MRIs with contrast. All I heard was that it's super safe. I left that appointment feeling fine until it got a little bit closer to the time when I was supposed to have that MRI done. And then I looked into what would be used as the contrast agent, and it's gadolinium, which in numerous other countries, it is banned from use. A specific kind of it especially is banned. And I've had this test done once before, not that many years ago, when I didn't know any better, but I was pressured into doing it. I was pressured with guilt and told, like, this scan is useless if you don't do this. Think about your son. You could have cancer. So I had that done, and so I've already been exposed to this stuff. And I did research recently, when I was getting ready to go to my MRI appointment, and I found out that gadolinium deposits into your brain and numerous other organs, but specifically the brain is a problem to have heavy metal deposits in. But in the United States, I've been told this by numerous doctors, there is no research to state that heavy metal deposits of gadolinium in your brain leads to any health consequences. So I'm supposed to go along with it because of that. I don't know, some people don't even care when they're older, but I personally, I really do care about my health now. And I ended up going to get the MRI. I drove very far, I took off of work, went to get it done, and I wanted to decline the contrast material because according to the internet, you have the right to do that. And I went there, and the lady, I mentioned this in the last video, so I'm just trying to sum this up. She told me, like, there's no way, you absolutely can't do this without the contrast. We will not do it. The people who read the results, they won't accept it. And this is what I've found now. The radiologists who read the results, they're the ones who control this whole scenario that's been going on. Wherever you get it done, they're in control, and they're going to say yes or they're going to say no. And it's likely going to be no unless you do exactly what they want and the test that they want you to have done. After that happened, I tried getting some help from that very same doctor who I drove for many hours to go see, and she was very rude to me in an email. So I decided to be done with that situation. And then interestingly enough, within like a week later, I received a letter in the mail saying that she resigned or retired, no, resigned. And everybody in that high-risk breast cancer center resigned. So the office is shut down and closed. So that was interesting. And after that, I went and I ended up seeing a couple other doctors because I have been trying very actively to get checked out. I went to one medical center. So I've been going to like different medical centers entirely with whatever options I have within a couple hours from here. This place was an hour from my house. I've had great experiences with other doctors at this location. Except for one who kind of botched me on my back. But you gotta kind of accept what you have and do your best. Every single doctor is going to be different. And so I met with a physician. She tried her best. She put in the referral and I was ready to go do that, and I was happy that I could get it done. And then I found out she ended up contacting me, that physician contacted me and said they absolutely will not do it unless you get a mammogram or if you've had a recent one. And I'm like, well, I had one 3 years ago. It's not gonna change that drastically considering they can't see my results well anyway on mammograms. And so I provided that to her. The radiologist said absolutely not. And then I ended up going onto the website. I was disappointed. I went onto the website to cancel my appointment and it said, why are you canceling? And I wrote this as carefully and politely as possible, but I wrote something about how I was refused my breast cancer screening, refused care or my breast cancer screening because I opted out of getting a mammogram. Then guess what? I got a phone call from the radiologist. I honestly can't remember exactly what she said, but it wasn't very helpful. She tried. She was trying to cover her back and try not to like get in trouble or something. I don't know what's wrong with people. Just help people get the care that they need and give them an option. Give them options. So once again, I was being pressured and I just decided to leave that location, leave that aside. I found an OBGYN who seemed to be highly rated, so I went to see her. Oh my goodness, you guys. So I got examined. Haven't done that in a while. Everything worked out like in good timing, and she was very nice, really nice lady. When she found out that I had a genetic mutation, she kind of, her whole vibe, everything changed, honestly. And this is what's been happening lately too. They go like from 0 to 100 to the extreme, like, oh, you have a genetic mutation, you need to go to the oncology center, you need to go to the cancer center and try to get care there. And once you get to one of those places, from what I've heard, the exams that they want to do on you are the invasive ones. They are the MRIs with the contrast. They want to get you checked often, and I feel like just going to a place like that unnecessarily can put you in a bad mindset, and it affects your mental clarity on the situation because how far are we taking this? How extreme is this? There's a lot of unknowns. They can tell you, like with my mutation, for example, your risk of getting cancer could be anywhere from 20 to 45% in your lifetime. And then they could tell you, as an average woman, your risk rate, it could be 22%. I honestly can't remember what it is. But there's just so many unknowns, and it's not specifically clear for my particular mutation. So I saw this lady, talked to her, and oh my goodness, you guys, she was recommending a lot of things. She's recommending, in a way, not like outright telling me to do this, but really highly encouraging a double mastectomy. And also, why don't we just cut out my ovaries, which I desperately would not ever do that. Like, I have enough problems. I'm not going to unnecessarily cut anything out Been there, done that. I'm not doing it. If you need to, if you're at risk, if you have cancer, of course, do whatever you need to do for your health. Yeah, so I could imagine that some young women, besides myself, could be influenced by what she's saying. And I think that in the past I could have been influenced by that, but that is not for me. I do understand that for some people that is the right choice and you're really happy with your choice to do that. For me, I absolutely do not feel this is necessary because I have cystic breasts, which isn't that uncommon, honestly, and cystic breasts isn't breast cancer. You know, I think I'm gonna have to travel to Florida and I'll visit with my dad, and while I'm there, I'm gonna pay out of pocket to get breast ultrasound done. And that's the only idea that I've had because I feel like I've exercised all my options locally. I've gone everywhere that I could have gone. I've gone to hospital, like different branches, and nobody's going to help me because they want it done their way. And then I ended up having an appointment. So like I said, at this point, in my heart, like I've given up. And in a way, I know not everybody has this same belief system, but like I've had to just say, like, to God, please take this from me. Like, please help me and please take this from me because there's nothing, I can't do this. Like, I can't do this. I really did try my best and it didn't work. And I really traveled all over the state and it didn't work. Normally in the past, I have given in, like I said, to the pressure. And in my mind, I'm like, should I just do what they're trying to make me do? But I shouldn't have to do that when I just shouldn't have to do that. I shouldn't have to be pressured into like some forced medical care that I don't need. I'm open-minded. If I need more tests, I'm open-minded, but I need to start somewhere. I ended up having to make an appointment with a new primary care doctor. So this wasn't the highlight of my week. I think I almost didn't go to it because I just, you know, there's some days where you're just like, I cannot do this again. I don't want to deal with this. The thing is though, the VA was trying to help me so that I could stop driving really far to go to the VA, and then I would have a local doctor. And I chose a specific place where I've honestly had a horrible experience before. So it's not like my hopes were very high, but I just went in there with my new doctor. I believe I chose this doctor because his name sounded familiar. I feel like I've heard his name before, or maybe he's been recommended to me, and I mean years ago. So I chose a specific doctor out of several options, and I didn't do any research on him because I just picked him, went there. And I had such an unbelievable, wonderful experience there talking to him. Somehow the breast screening was brought up. Like I said, I never intended to bring it up because I just didn't think about this appointment beforehand. I just went there with no thoughts, just went in to get it done. He said so casually, like, so you want a breast ultrasound? That's totally fine. You don't need to get the other ones done. I understand about, you know, your history and the radiation and all those things, but if you just want to have a peace of mind, you can definitely get a breast ultrasound. I'll just put an order in. And so I was so floored. There are no words for how grateful I was. And then also on top of that, to make things even better, the place where I'd have the ultrasound and this hospital that I was at, it was only like 15 minutes from where I live. And that is unbelievable because every other time I need to get something done, I have to drive for an hour. And this is a small town area where I saw this doctor. And in the past, I don't believe, like even 4 years ago, they didn't have ultrasound machines. They didn't have anything. Like they had to have a truck pull up with like certain scanning machines. And so this was huge. Like this was a big deal. I was so grateful. And then I went home, and a couple of days later, you guys, my heart was broken a little bit. I got a phone call from the nurse who works with that doctor, and she just said, I am so sorry, but I just got off the phone with radiology. She said they absolutely will not do the ultrasound unless you have a mammogram. They just will not do it no matter what. They're not budging on it. There's not going to be a change in their mind on that. And I was so kind of disappointed, honestly. And then, of course, my first thought, Florida. I guess I have to go to Florida. With this nurse who I was talking to on the phone, I did ask her, I was trying to think of some way this could be salvaged. So I asked her if it's possible for me to get the ultrasound done 1 or 2 hours from here because there are other locations. And there was one other location where I used to get the ultrasounds done, and it did not require a mammogram. She told me that she was going to call them and do her best, and she's going to try to set something up if she can. She's just at least going to try. And I just told her, like, I appreciate that so much. And then the weirdest thing happened. I cried one tear. I really did, because it's just like, I'm burnt out, you guys, of trying to get help and just trying to get this ultrasound done. I told my son about the situation, and then I got a phone call, and it was from radiology. She calls me, and I just 1 minute ago got off of the phone with the nurse. I told her, you know, I heard that I'm not going to be able to get the ultrasound done, and because I'm not doing the mammogram. And she said, well, no, we can do the ultrasound without it. We're going to do that for you. And in fact, I would like for you to speak with our head radiologist who lives in another county, who's several hours away, and she's going to share some more, you know, information with you. So I was like, okay, thank you. But first I did question her, like, but I just got off the phone with the nurse who said, you know, that it's absolutely not going to happen. And there was no explanation from the radiology lady. She just said, no, we're gonna do this for you. So I don't know what happened. Something happened in between there, and I don't know how and how fast that could have happened or what's going on. But I went with it. I was confused and surprised, and I went with it. So then I talked to this radiologist, and I cannot tell you how grateful I am. She was extremely kind, extremely honest, and she wanted to inform me of all of the risks and all of the benefits to every treatment modality, every screening modality. So we're talking about the MRIs, the mammograms, and other options, and the ultrasounds. We conversed about all kinds of things related to the medical studies, the gadolinium, the heavy metal deposits, all that stuff. And I feel like she was very respectful to me, and I also acknowledged and appreciated what she was sharing with me because I didn't know all of the things she told me. And she did mention that mammograms are excellent at detecting precancerous lesions. So if they're really small, mammograms can detect that. And she also mentioned that for ultrasounds, they are really excellent for dense breast issues. She said they can detect cancers the size of like a pencil or a pencil eraser, and that was very helpful to know as well. After that conversation, she actually got me in that day to have the ultrasound. It's almost sad in a way that I have to be so desperate in a way, and also so grateful for what some might consider this basic medical screening. Thank God for this lady. I will appreciate her forever. So what she said is she understands where I'm coming from and she's fine with it. And so I'm going to have the ultrasound, and after the ultrasound, she's going to call me right after the appointment. I'll be in the room. She's going to call and give me the results. And that's exactly what happened. It took a very long time, honestly, to do the scans, and it took at least an hour. So I've had ultrasounds done before on the breasts, and they were not usually that long. So I could tell she was extremely thorough, and she also got into areas like really into the armpit area and around the breast area, like further back and away, to the point where she was really looking at everything, which is amazing. That's great. So I ended up getting the results on the phone. The results are completely fine, and that she is actually completely confident in the ultrasound as being effective for me. She said she has no doubt about what she has seen in the ultrasound results, and comparing them to my last scans, which were ultrasounds and MRI. I've had an MRI and I've had mammograms, and she compared them, and they're basically the same as before. I think one doctor in the past, I might have said this in the last video, told me I had a complex cyst, and she disagreed with that. She just said it was a cluster of cysts, because there is quite a difference in that. I think a complex cyst could have more potential to be cancer with solid nodules or solid areas in it, but mine didn't have that. Overall, everything was normal, and she said that there was absolutely no doubt in her mind about that, because if she had some doubts or had some issues of concern, she would have recommended MRI probably, but she didn't. She said that very clearly, that there was no other recommendation, and she feels very confident about this. And then she also told me to keep her information, and in 1 year from now, I can come back and get another ultrasound. Thank God. And if I want to get something else done, for peace of mind, for whatever reason whatsoever, I can get something else done. That was an absolute, almost like a miracle to me, to be honest with you guys. So that is my insanely long story. I didn't plan for this to be so long. I'm sorry if I'm rambling. It's very early where I'm at, and I just tried my best to give you guys, you know, the full scope of the situation. I'm just super, super happy. And when I went in there, I wasn't thinking that anything bad was going to come of it. I just wanted to get the scan. I just wanted to have the results, whatever it was going to be. I honestly didn't think like, oh, I'm scared it's going to be this or that or whatever. I just went to my appointment and was just happy to have the appointment, honestly. I just want to thank you guys who are watching, because the last video ended up getting a lot more views than I imagined, and it attracted a lot of people to my channel who have never been to my channel before. And I really appreciate you guys sharing your stories and your struggles, because a lot of people have experienced similar issues. Thank you guys again, and take care.